what are the challenges that we face in adequately communicating with each other?
I think one of the biggest things that, all of us face is time. We're all time constrained. We all have, we get our patients done for the day, and it's 5 p.m., 6 p.m., and, we got a bunch of voicemails of patients we got to get back to, and think about patients that we need to communicate to another provider. It just adds a lot of complexities to what we do, and sometimes I think the majority of us care a lot, and we really want to do our best, but we just get so stretched thin that communicating with another provider is difficult.
I think one thing that comes up in clinic a lot for me is just that you've got patients and they say, I saw this provider and they did something, I'm not sure what. So having the tools to communicate what their charting system says with ours so that we're all on the same page is a struggle at times.
Systems definitely are a challenge. There's a lot of privacy concerns that we have to abide by as well that do hamstring us a little bit, and we have to be protective of our patients' personal information and keeping that in mind while still trying to expedite, communication verbally as well as our records. It's just complicated, unfortunately.
Yeah, I think that there's a desire, but it's hard. Time is definitely a constraint. The system, HIPAA, lots and lots of challenges to communication, and yet it's critically important. So how do we improve communication one with another? What can be done?
I think something that I've really enjoyed is going to events, being interactive with your colleagues, because if you know them, you're more likely to reach out when there's an emergency. I feel like we kind of talked about this morning, but just like having trust in the people that you work with and around you creates trust in the patient's care as well.
Yeah, we've talked at length about how in medicine, in every industry, there's a currency, and in medicine, the currency is trust. And so our morning conferences and yearly conferences and other interactions are intended primarily to develop trust amongst the providers and allow those lines of communication to be established.
I think one of the big conversations today was, abolishing silo care and thinking that I can solve all the problems of the patient, and more in the sense of how do we work together? And I think one of the biggest things I've learned through medicine is that I have to know your role, I have to know my role, and I have to trust you enough to know when to call you and when to call you and when to call you. And, sometimes there's patients in my office that should not be in my office. And I have to know who's the person that I should call to get them in the right office.
I think in medicine, the very best example of good communication happens in a trauma, where you have a lead and you have defined roles and you have pathways of communication. Carolyn Hansen is preparing a rounds discussion on that very topic in a few weeks, and I've encouraged her to help us understand how that applies to communication generally, because we don't have defined roles always or defined lines of communication, and maybe we need to spend some time to really elucidate that and make it clear to people.
Just from a logistics standpoint, I think we've had a business relationship, business associate agreement with Summit, where you guys can actually access our records. I think that makes it easier. I mean, I would love to say my staff is really good about sending every single one of our notes out to you guys as soon as it's signed, but I'm not naive enough to think that we're 100% good on that end. So we at least try to open up other avenues so you can access things that you're missing. Just like we can get all of our radiology reports from any imaging center we have, it's important that we have that communication, especially since what we do is so closely integrated with our patients that go back and forth with interventional treatments.
Yeah, thinking having the EMR and the records support lines of communication. I've wondered why the patient doesn't have their own records and why they aren't the conduit for taking records from one place to another. And hopefully with some technologies coming out, we can solve that problem. But having a direct access to each other's medical records or be able to send records easily is important.
But most importantly, it's the relationships that we have. You know, if I'm in a bind, I know I can call anybody here.
I know if Jeremy Doyle calls me, I got to answer that.
It's important.
I try to reserve that for the 911s though. So
Yeah, that's why I answer. You know, if you do it too much, then I say, is Jeremy calling again?
Wants to know how my golf game was.
Yeah, ultimately, you know, communication. We all got to be respectful of each other's time, and you know, anytime I call Dr. Joyle, he answers my phone call. It doesn't matter if it's in the middle of the day, and you know, I try to do the same with all docs that call me too, because our time is limited. You know, you might be with the patient, you need to make a decision now, and it's not going to be convenient 4 hours later. You know, and they're quick conversations. You know, it's not like we're shooting the breeze for 20 minutes, but you know, it's quick. You know, I can't remember the last one that's lasted over 20 seconds, 20, 30 seconds, but that piece that we give each other is so vital.
Yeah, there's a lot of unwritten communication that we don't get through our notes that we can easily summarize in 20 or 30 seconds in a direct conversation.
Hey, this one's having a problem. What do you think? And so the case we talked about this morning was great. I think it would be almost better for people to go and watch the discussion because it really is worth watching. But a wonderful discussion and a good specific case highlighting how communication barriers are there and how we really need to make every effort to connect with each other to improve care for each individual patient.
Yeah, absolutely.
Thank you so much for coming.
Thanks.
That's awesome.
Appreciate it.